Hi, welcome once again to Senior Focus. I'm your host, Bill Adams, and Senior Focus is a show designed for people over the age of about 50 or so. But of course, if you're any age, if you know people who are over 50, you can share this information with them. We come to you through the good graces of Armstrong Channel 20, which is run by Greg Roten. He is nice enough to help us out and get the show produced and on the air. And also, we thank every time Keith Kaiser, because Keith allows us to use the Davis Visitor Center at Mill Creek Metro Parks. And we encourage you to come out and join in the activities at the Davis Center. It's beautiful all year round. Today, we have three ladies who are going to be talking about heart disease and the treatments that are available in the area, specifically through Humility of Mary Health Partners. And I'll introduce them from my left all the way across, and it'll be going from the left to the right as you look on the screen. To my immediate left is Mary Lou Parisi, and she is a patient, and she's going to be talking about her experience. Yes. And then to the left of Mary Lou is Joanne Delaquilla. Delaquilla, yes. I'm sorry. We were talking about that before. She's an exercise physiologist, and she'll describe what she does. And Kim Albrecht, who is an RN, and she works at St. E's, and she's going to talk about her work. So welcome to everybody.
Thank you. Thank you.
And this hits home for a lot of people in the Mahoning Valley. A lot of folks have had heart ailments in their family or themselves. And I know personally, I know of people in my family who have been affected by heart disease and illness. And this is for the two ladies that work through Humility of Mary. Either one of you want to talk about what is just the overview of what the services are that you have at Humility of Mary, where they're located.
Okay, well, I am an RN, as we said, in the CHF clinic, the Congestive Heart Failure clinic at St. E's Hospital downtown. We also have a CHF clinic at St. Joe's, which is what these gals are going to talk about, how they're intertwined with the program there. Mm-hmm. But our CHF clinic is an outpatient facility designated to see heart failure patients. And what we do when we see our heart failure patients is our goal is to keep them from getting admitted into the hospital, to keep them out of the hospital, to keep them as healthy as we can, to educate them on dietary things that they need to do, low sodium, fluid restriction, weighing daily, medication compliance. All of these things play a very large factor into their overall health and wellness. Mm-hmm. And like I said, our goal is to keep them from getting admitted into the hospital. We're kind of the eyes and ears for the physicians that send them to us. And if they do start holding on to fluid, becoming short of breath, have symptoms of decompensating heart failure, we give them IV medications, oral medications, whatever it takes to help pull that fluid off to get them breathing, feeling better, and hopefully out of the hospital. Mm-hmm.
Joanne, do you work then at St. Joe's?
I'm at St. Joe's Outpatient Cardiac Rehab, yes.
Okay.
And there we telemetry monitor patients that have recently had some sort of heart event, whether it's open heart surgery, heart attack, stent insertion. We teach them how to safely exercise to get their heart function back, get them back to their daily routines. Mm-hmm. I work closely with the RNs there, excuse me, as we watch their heart rhythm and rate. This year, we joined up with the Congestive Heart Failure Clinic at St. Joe's and proposed a grant for their patients to come in and exercise with us. Currently, congestive heart failure is not covered by insurance, so those patients that would definitely benefit from our service, it has to be self-pay, and for a lot of them, it's not part of their means, so they go without. So our grant proposed allowing them to come in. They get education from the Congestive Heart Failure Clinic at St. Joe's, and then they come into exercise with us, where we initially start them out with a 6-minute walk test. They walk, we monitor their vitals every minute, we keep an eye on their rhythm, and then at the end of the program, after they've exercised for 4 months, we repeat the test to see what improvement there's been. And it's been very successful. It had a slow start this year. for a variety of reasons, just because I don't think the word was out enough and people just didn't know enough about it. But we've had about 15 participants, and it's gone very well.
Is Mary Lou one of your participants?
Mary Lou has been a great participant. Yes,
Yeah.
she's done very well in the program.
Thank you.
Yeah, Mary Lou, would you mind talking about how you got started in the program and I get maybe what your expectations were going in and what the reality has been for you?
Doctor sent me through St. Joe's. It's been a blessing for me. You know how they have the Hope Center for Cancer. This is my Hope Center for Congestive Heart Failure. When I went into it, I thought I was on my death sentence, I was telling them, because there's no cure for congestive heart failure. But I did find out it's a manageable thing, that you can be educated by these women to get through what you need to and live a better life. And I was the one that said, you'll never get me on that treadmill, because I knew that I just couldn't do it.
And how many minutes are you up to now?
20, I think. Very good. Yeah.
Oh, 20 minutes.
Yeah.
Well, that's about as far as I'd ever go.
Well,
So that's good.
we have other machines that I do too, so I try and do at least an hour to 70 minutes, and then.
Oh, okay. So you built up to that, I imagine, right?
Oh, yes.
Yeah.
Yes.
Now, were you working together with other folks, or I mean, are there other people that are going through this at the same time, other patients in the room?
Yes. We have a nice size. And they rotate different days, and we've all learned to manage to rotate ourselves through the different machines and that by our needs and that, along with their assistance.
Now, I've heard talk about a number of things. We talked, it was mentioned about diet, exercise. What about, some of the things about diet that people maybe want to watch out for, or they should be, alert to?
Right. The biggest thing with the diet for congestive heart failure is low sodium.
Yeah.
Sodium is the main culprit. You want to be under 2,000 milligrams a day.
Okay.
If you can, it's even better to be at 1,500 milligrams a day. Along with that comes a lot of, lifestyle changing, learning how to read labels, knowing that you really shouldn't eat anything with more than 300 milligrams of sodium per serving. And that's where they get you on the labels, per serving. Most foods have 2 servings in their portions, so you have to be careful. And it's just educating and being aware of that.
Right, just knowing that, like snacks.
Processed foods are
right.
huge. Lots of people say, well, I don't use a salt shaker.
Right.
Well, it's not that. It's most of the sodium is already in the food. All of the processed foods, of course, the lunch meats, the bacon, the sausage, boxed dinners, mac and cheeses. And then another huge thing is going out to eat, restaurants,
Right.
Fast food. They're just loaded with sodium, and that's the toughest part, I think.
Yeah, in my own experience, I know there are probably several out there, but there's something called Calorie Count, that where you can plug in the food that you eat, and it'll actually give you a breakdown of the sodium and all
Yes.
the content.
Yes,
So that's
perfect.
probably helpful if people write down what they're eating.
Yes.
To track that.
Exactly. They keep food diaries, and then we go over the food diary with them and try to, modify it and help them out and see where we can make changes.
And also on the exercise end, I would imagine a lot of it that you, in dealing with the patients that you work with, you have to be aware of the psychological, I guess, impact of the disease, that people are maybe wary of getting started in exercise. I don't know if that was a case for Mary Lou, but
Yes.
Kim, if you or Joanne, if you want to talk about that also.
Oh, yeah, Mary Lou was terrified when she first came, and that 6-minute test, for someone who's a healthy individual and doesn't have issues, 6 minutes is really not that big of a deal. But for someone who doesn't feel good and has shortness of breath, and is afraid, because now all of a sudden they're faced with all these challenges that they didn't have before, it can be a very looming thing. And for Mary Lou, those first 6 minutes, she was surprised that she got through it. And then at the end of her first 4 months, redoing that 6-minute test, it was great because she was talking about playing soccer and going back and forth. She was a force to be reckoned with, so.
Well, we're a soccer family, so.
Nice.
It was very rewarding for me to see that, you know, our group was a part of helping her get to that point. So, and the confidence level that we see in Mary Lou
Yeah,
now.
it's really grown.
Well, Mary Lou, you just mentioned you're part of a soccer family, and that made me think that, has this helped you in terms of going out and doing more things with your family and being more active?
Well, it's made it easier for me to walk all the way to the back of the field for a game. You know, being grandma, you got to be there. Yeah.
So you've been able to get out and about a little bit more?
Oh, yes. Yeah. Get up out of that chair because you need to. One thing I wanted to say too is the nutrition classes, they have excellent videos for
Okay.
teaching you all this. It's very, very good program, the whole total program.
Now, have you had to work, Mary Lou, with your family about the eating? Because as we talked about, you know, Kim was talking about when you go out to eat, you got to be
Right.
careful of watching your salt. Is this sort of a family group effort where you have to say, look, you know, I can't eat as much salty things as maybe we used to?
They're learning with me,
Yeah,
yeah.
yeah.
Even the friend, you got to tell them, hey, I have to go somewhere healthy to eat.
Joanne, what are some of the exercises? We heard about the treadmill. Can you walk us through what the room looks like and some of the different things that people do?
We have a variety of equipment. We have a lot of seated equipment because a lot of our patients come to us very deconditioned, and the treadmill is kind of a later thing. We have what's called a new step. The patient sits in the seat and they work both their arms and their legs. It's kind of like you're going up the stairs in a seated position.
Okay.
And it's very patient-friendly. Patients that have orthopedic issues, knee problems, back problems, it's a very supportive piece of equipment. We like for most of our patients to start out on that because that kind of helps us test the waters to see what they're capable of doing. We have a variety of bicycles. We have what's called an armagometer, where you sit and you rotate the wheel with your arms at different resistance levels. It'll get your heart rate going. We also have some higher end equipment. We have an elliptical machine for those patients that are more advanced, and a rowing machine, which is full body. And even that machine we can use on our more deconditioned patients because there's different, you can do it in a modified way where it's not as taxing as the patients that are a little more advanced. So it's kind of nice to break it up for them, get them involved in some other equipment. And we also have strength training for our patients.
And I don't think we've mentioned at the top, maybe Kim, you could talk about, again, where this is physically located and maybe if there are contact information, phone numbers or website or something like that.
We are physically located, the one at St. E's, downtown on Belmont. We are on the first floor there. There is, I believe that's on our website. It should be on our HMHP website. But our phone number to the CHF clinic, and all you need to do to become a patient in the heart failure clinic, if you do have heart failure, and there are various stages of heart failure, so you do not have to be a stage 4. You can be in early stage as well. But all we need is a physician's referral. From either your family doctor, your cardiologist, we have pulmonologist, any physician that's on staff with Humility of Mary can just send us a referral. And our contact number is, it is 330-480-4327. Yeah, it's quite easy to get enrolled and to get started with us. We see you as often or as least as we can. It varies per patient. You know, we try to give you some leeway once you're doing well and kind of keeping on track. If you should fall into problems in between visits, you just give us a call and we get you in. And like I said, our goal is to keep you from getting admitted into the hospital. So
Have you been able to track over time? Is it long? Have you been doing it long enough, I guess? So you found good results from this?
Oh, absolutely, we do. We have wonderful results.
Is that tracked through like maybe decreased times in the hospital and just health outcomes?
Exactly.
Yeah.
Many patients, you know, we definitely save them trips to the emergency room. Many times they'll We notice a lot, after the holidays maybe, or after picnics, when you're eating things that other people have prepared and they're not aware of the low sodium.
Right.
And it takes, it does not take much sodium for a weakened heart to start holding on to fluid. It happens actually rather quickly.
Okay.
And all it takes usually is, a phone call to us, and we'll see, we see some people 3 times a week, 4 times a week if we have to, whatever it takes to keep them out. We'll do some IV diuretics, adjust their medications with their doctors, keep an eye on their lab work, make sure that their kidney function is fine during the whole thing, their potassium, and we get great results. If we can catch it early, that's usually the main key. We can get it off quickly and get you feeling better and out of the hospital.
Earlier, Joanne, when you were talking, you used the word, I think, telemetry. Can you explain what that is and how that relates to what you were saying?
Oh, it's, what we use is a 4-lead placement so that we can get the different views of the heart. We can watch the patient's heart rate and rhythm while they're exercising.
Oh, okay.
So we can keep an eye on it, make sure that the pattern stays the same and that they're not running into trouble while they're exercising.
Yeah, I would imagine, Mary Lou, when you're doing exercise in this setting, when you've got all the professionals around and they're obviously
Right.
keeping track of you, maybe that gives you a little more peace of mind.
It does,
Yeah, rather
definitely.
than, I'm going to do this on my own and, hopefully everything works out. But here you've got professionals right with you, right?
They took so much fear out of me, that's all I can tell you. It's back there now, it's gone.
Now, how long have you been exercising?
I did 4 months, my first part of my grant, so I'm on my second part of the grant, so probably 6 months now.
Yeah, I would, yeah.
And have you, we talked about how you work with other folks there are other patients. Is there like a group that that you talk with or that you've met, friends through that?
I think we're all friends one way or another.
It's a very social setting, which that is also key in the program. We have people coming in, after they've had open heart surgery, and again, they're afraid, they don't feel good, and they can't imagine that they're going to be able to, do 10 minutes, let alone work up to a whole hour.
Right.
And then they see the person next to them that's clipping along on the treadmill at 3 miles an hour, and they're like, oh, well, I had the same thing 2 years ago, and I've been here ever since. And they see that, and it's inspiring. Then they, oh, all right, baby steps, I'll get there. Consistency is key. So.
And maybe it was Kim that mentioned earlier on about the stages, or are there 4 of the disease?
There is the way that they're classed, right? Stage 1, 2, 3, and 4. 4, of course, being the most advanced and the most debilitating. So you probably see most of our patients are, 2, 3, or 4.
Okay.
Depending.
And you could work with anybody, whether it's sort of beginning or more advanced?
Yes, we do. I don't know about the exercise part.
The exercise, the stage 4 candidates, it really is not safe for them to exercise. So basically, we are with the stages 1 through 3 in our grant program. Yes.
And where, again, maybe a little bit more about the grant, explaining where that's from and how that works.
The grant, we were afforded the money through the HMHP Foundation. We had room for 39 participants, and as I mentioned earlier, it was a little bit of a slow start, so we only had about 15, I believe it is. We are looking towards working on a new grant for next year with the exposure that we've had and having more participants that come into it. The patients are referred by the doctor. They go through the CHF clinic for their initial assessment and then their education, and then they come to us for the exercise for a 4-month stay. And because our participation was limited, for those patients that came in early in the group, we allowed them an additional 4 months since we had the room for it.
So at this point, you are accepting new people then? It's not a question of people would have to go on a waiting list at this point?
We do have room for additional people. I'm just not 100% where it's going to be with the grant right after the first of the year. We're still in the works with that. But my feeling is if we have interest, that will help our cause as far as, having new openings.
Who else works on the program? The 2 of you are here, but do you have several staff that are working on the grant program? Or,
With the Congestive Heart Failure Clinic at St. Joe's, there's two nurses that work closely with us in their department, and then our staff, we have two RNs, and then myself that work on the program.
Mary Lou, have you changed, I guess, just your thinking in terms of, the long term? Because I imagine when you get that initial diagnosis or you're initially ill, you might get some depression or you might get down.
Definitely.
Yeah, and so how does that feel, or how has your outlook changed, I guess, from going through something like this, the program?
Well, like I said, it provides you with hope. You know that it's out there, and if you work it, you see the improvements.
Mm-hmm. What about when somebody like Mary Lou is out of the program then, and they go home, is there follow-up with folks, or, because again, it is time limited. What are they sent home with as far as, here's maybe an exercise plan that you could do at home?
Right, well, part of my position is to come up with exercise prescriptions for our patients. I give them guidelines to follow as far as keeping an eye on their heart rates, things to look for as far as, being able to talk while they're exercising. That old adage of, no pain, no gain is really not true.
Right.
Exercise should be challenging, but it shouldn't feel like, holy smokes, I can't take another step either. So as they're coming through the program, and we talk about stuff like that constantly, so that's not something that's just left to the end. It's an ongoing process the whole time that they're with us in the program. So,
is there equipment that people can use when they're exercising at home? Again, when they're with you, they have monitors and things like that, but are there lower cost, like pulse monitors or that type of thing that maybe they can use when they go to do this
you
at
can
home?
find the pulse oxes. I know Aldi's has them occasionally affordable. Walgreens does too. Of course, you can buy the higher end of them, online and all that, but you can find affordable ones at the local drugstores, I think.
Mm-hmm. And Kim, how long have you been associated with the clinic?
I have been with Humility of Mary for 21 years.
Okay.
I've been with the clinic. The clinic has actually been open for, I believe it's on its 15th year.
Oh, okay.
So it's been around for a long time. It's a wonderful, wonderful program.
Mm-hmm. Do you have alumni sort of people?
We do.
Yeah. Do you see them on a
We
regular basis?
We
Yeah.
have patients that have been coming for years, and that was one of the things. When Mary Lou is done with cardiac rehab, she will still continue to be a congestive heart failure clinic patient. So she can still, bring up concerns. They can still touch base with how well she's doing with exercising, or, maybe give her little tips of, with even just walking and, things like that. So that's the nice thing. The support is always there.
Yeah.
It's always supportive. It's always
Right.
collaborative.
Part of our hope with the grant for next year too is for there to be, just a continuous maintenance type of, like what we have with cardiac rehab. We have maintenance people that, once they're done with the 36 sessions of cardiac rehab, then they stay on with us. And that's part of what our hope is for next year, to continue with that.
When will you learn about that? Do you know?
Probably not until after the first of the year.
Okay.
Yeah, so it's still in the works.
Well, again, at this point, we have a few minutes to go. Could we give some contact information? Again, maybe Kim, if you want to give out where this is all located and where people can call or get more information.
Right. The Congestive Heart Failure Clinic, the number's 330-480-4327 at St. E's. The number at St. Joe's
Is 330-841-4001 for the cardiac rehab department, and the Congestive Heart Failure Clinic is 330-841-4327.
And you did bring in this, and this is it's called the Patient and Family Information Series, What You Should Know About Managing Heart Failure.
Yes.
Is that something everybody gets when they first start?
That is any patient that is even admitted into Humility of Mary, the system, any heart failure patient is given that book. It is a wonderful piece of information, yes.
Is there anything that you wanted to talk about, Mary Lou, about, again, maybe just your favorite exercises or things that you've enjoyed? I guess a lot of people think of the term exercise and they think, it's not something I want to do. But I would imagine once you start feeling better, you actually look forward to it.
Probably mine's become the one thing I said I'd never do,
The treadmill?
the treadmill.
Uh-huh. And when you're on the treadmill, are you able to do, sometimes at health clubs, they have like a TV or anything? Is there, or do you talk to people, or what do you do when you're on the
Both.
treadmill?
We have lots of TVs that have, for every station.
Mm-hmm.
And then we do a lot of talking.
And
It's very loud in our area, yes.
Yes.
how often are you doing this? How many
You're
times a
allowed
week?
2 times a week.
2 times a week, okay. And then when you go home, are you doing things also in the house or around the house or in your neighborhood? Do you do other, do you do some walking there also, or do you pretty much just?
I love to shop, so most of my time is spent walking. Sometimes I'll just go to the store and just keep walking around, just not buying anything, just staying active.
Mm-hmm. Well, I think, yeah, if you go to the mall, especially in the wintertime, you'll see a lot of people out, before they open,
Right.
or even during, shopping hours. So I imagine, at some point, you might join them, that group walking around. Well, again, we've been talking with, from my left is Mary Lou Parisi. She's a patient with Humility of Mary Health Partners. Joanne Delaquila is the exercise physiologist with Humility of Mary. And Kim Albrecht is an RN, and she's with the Congestive Heart Failure Clinic at St. E's. Is there anything we haven't covered that you wanted to mention? We have a couple minutes ago.
I think we've done a great job.
Okay. Yeah, and again, it's a grant program. It's continuing into next year, but you're not sure, again, how many total people will be involved. At this point, you are accepting new people, and it just takes a doctor's order or prescription.
Right.
Okay. And you will take stages 1 through 3?
Yes, that's correct.
Okay. Again, you've been watching Senior Focus. My name is Bill Adams. We come to you a couple times each month with different shows that hopefully you could take the information and use in your daily life. I want to thank Greg Roten from Armstrong's Channel 20. And Greg brings the show, produces it, and brings it to you every week. And also, thanks to Keith Kaiser, we use the Davis Visitor Center at Mill Creek Metro Parks. We want to thank Keith for the use of the room to film the show. And thanks most of all to you for watching the show. And in case you didn't know, Greg puts the show on YouTube afterwards. So if you saw a show and you want to see it again, or you saw part of it, you can go to YouTube and just type in Senior Focus, and you'll be able to find it there. Again, thanks for watching, and we'll see you next time.